if you had an injection and you did not see any improvement whatsoever, the chances of you having an improvement by repeating that exact same procedure are slim to none. What's up, everybody? We got another episode here of Curbside with the Doctor. So today we're gonna keep this one nice and short because I got a jet, but I want to talk about this concept of retreating an area based on an initial response. So if you have an injection, and it really doesn't matter what is in the injection, whether it's a steroid, whether it's an autologous stem cell procedure, whether it's PRP, dextrose, whatever is in the syringe, as long as it has some therapeutic value. If you get no response to that treatment, so sometimes with steroids, right, you can have an improvement in pain that might last for a few months and then it just goes back to baseline. That's still an improvement. It now went back to baseline, but in my mind, we still consider that an improvement. But if you had an injection and you did not see any improvement whatsoever, the chances of you having an improvement by repeating that exact same procedure are slim to none, okay? The only way that you could get an improvement on a second procedure is if the first procedure was not done correctly. So, as an example, if your first procedure was a caudal epidural steroid injection, so you had an epidural at the caudal location and they used steroid, and that did nothing for your back pain at all, nothing. And then they do a second one, and maybe you actually do get a positive response, meaning let's say you get 60% improvement that lasts 3 months, okay? That means that your first injection was done incorrectly and they were not in the epidural space. But the reality is that the doctors who are doing these injections have trained so extensively in these injections, especially if you're working in the conventional space. The chances of that happening are also super slim. And so if you've had an injection and a doctor then says, oh, well, that didn't work, so let's repeat it to see if it works. Oh, that one didn't work, let's try a third time just to make sure. That is an absolute waste in my opinion, okay? In my practice, if I do a treatment and I walk out of that treatment confident that what I did was in the correct location, that I used all the metrics I need to confirm I'm in the epidural space or whatever other area we are treating. If I do that and my patient comes back and says I'm no better, it means my diagnosis was incorrect. That also means that if you have had injections from a provider and they did nothing for your pain, that doctor's diagnosis on what was causing you pain was incorrect. They might have diagnosed a tear or something, some tendinosis on imaging, and they may have given you that diagnosis, but they did not diagnose your pain correctly. Because if you put something as powerful as PRP, stem cells, steroids, all that stuff is super powerful. If you put that near damaged tissue that is causing you pain, I'm not even going to say a percentage because there are no actual statistics on this, but near 100% of the time, that will have an impact on your pain. If you have no impact on your pain, it means they did not treat the correct area. Another way to put this is if your shoulder hurts and they inject your knee, guess what? Your shoulder's probably not going to get any better. Same concept, but we're just talking on a minuscule scale. If it's your facet joint that hurts, but they put medicine, no matter what it is, in the epidural space, that's not going to impact your facet joint. You need to treat the structures that are actually painful, and that starts with the correct diagnosis on what is causing you pain. So stop getting repeat injections. If the first injection didn't work, the second one's probably not going to work. Third one's probably not going to work. And you need to start looking at other pain generators. And if your doctor's not willing to, you just need to go find a new doctor. All right, everyone. See ya.